If you're interested, our topic for today that we're going to talk about is 5 practical tips how to pass the Nurse Adaptation Program here in Ireland. Come, Charlie, come. Let's start the vlog. Come here. Up. Good boy. Good boy. Hello guys, welcome back to the vlog and welcome to the channel. My name is Boyd Ventura and welcome to another episode of the Coffee Talk where I sit down and talk about a particular matter, whether it's about nursing or in Ireland, and we'll just have a chat. You and me will have a chat together over a cup of coffee. So if you want to grab your coffee, then go grab your coffee. So in this channel, my goal is to share whatever I learned, whatever I have learned in the past, to share to people like you who's out there watching. So guys, just a disclaimer, I'm not a clinical skills facilitator nor a clinical nurse manager here. I'm a staff nurse, and these tips that I'm going to share to you are just my personal experience. Well guys, if you don't know what the Nurse Adaptation Program is, it's basically like a preceptorship program wherein you will work in the hospital or the facility that you applied for, whether it's an acute hospital or a nursing home. The hospital will assign a registered nurse to be your preceptor. So the registered nurse can be a senior nurse, it can be a staff nurse who have been in the unit for like more than 2 years, or it can be a clinical nurse manager. So guys, I know the feeling is going to be stressful for the first couple of weeks or for the first month maybe. I've been there, I've done that. And so that's why I'm going to share to you these tips so that it will be easier for you. So guys, number 1 tip is to be ready to become a student again. So I'm sure all of us have, clinical experiences back home, whether it's 2 years, 10 years in a hospital setting or in a nursing home setting or whatsoever. But maybe you're a senior nurse back home at the age of 35, or you're 23 years old with 2 years experience in a smaller or tertiary hospital. But when you come here, it will be all new. It's a new environment, a new hospital, it's a new country for you, and things will be different. Guys, it is a different healthcare system. You have to be humble and you have to appreciate your preceptor, pay respect to them, because these preceptors will take their time at the bedside to teach you, to help you, and to give you advices on how to adapt. Set your mind that you're a student again. You're here to absorb things at this stage. You're here to kind of immerse yourself in the Irish healthcare system and take it in slowly. So guys, your trainings will be a mix of in-person trainings where you go to the classroom to learn certain topics. Then some of it will be done online on a website called HSE Land. Get your notebooks and pens or whatever, iPad ready. Take notes. Take a lot of notes, take pictures of these guidelines, policies, all of these things. Do it like, you're a student. Charlie. Practice your communication skills. So I know at this stage, we've already passed our English exam. You need to practice your communication skills. You need to convince yourself, or sometimes you have to fake it, you have to fake it to gain that confidence. Practice, guys, I was crying when I was taking or reviewing for my IELTS exam. For the speaking part of it, I was very nervous. And I always failed the mock test with the speaking because I stutter, or I just can't find the right words to say. If you don't know, Irish people loves to initiate small talks. Like they will ask you, what did you do on your days off? How was your weekend? Have you any stories to tell? Just don't be shy to kind of reply to them. What I will advise to you is that make yourself familiar with Irish slangs. When I was starting, I wasn't familiar with any Irish slangs. Aside from their accent, they have these different phrases that they say here that they don't normally say, like for example, in America. So there's a funny story, guys. When I was, I think it was my first day at the bedside, my preceptor left, and one of the anesthetists, he walked into the room. He was a young guy, Irish guy, and he looked at the monitor and he asked me, "So what's the crack?" So when he told me that, I was confused. I was confused on what he meant by what's the crack, What does this doctor want me to say? And then I asked him, what crack? So he just looked at me like, he was confused as well on my answer. So he went to my preceptor, and then I don't know, I think they just laughed, and my preceptor explained it to me. What's the crack means, what's the story, or what's going on, things like that they say here. It's good things to be familiar with them. Another thing is that, oh, he's gas, that's gas. So like, what's gas? Is there oxygen here or whatever? But gas meaning it's funny or it's hilarious. Yeah, you'll find it amazing once you learn all of these slangs. It's funny, but it's good. It's good to learn and to be familiarized with their culture and how they communicate with each other and other people. So guys, if you don't understand people or your colleagues or your preceptor, don't be afraid to ask them, I'm sorry, I didn't get that. Can you say it again? Or you can ask them to speak a little bit slower, because they would understand. Some people would understand, some people wouldn't, but most of them will understand, and they will speak more clearly and slowly to you. Some will mock you, but those are the kind of odd ones that you'll encounter. But in general, they're very nice and they're very understanding, and we all can speak good English, if not perfect English, but we're just really shy, I believe, because we're not we don't use it in our everyday conversation back home, at work, or even in our personal lives. Not unless you grew up very rich that you speak English all the time. Please don't be shy to communicate and to speak English. Forget about that you have a certain accent. That's all good. Just make sure that you get the message across without any misunderstanding. So guys, my third advice would be somewhat related to number 2, which is don't be afraid to ask. If you do not understand something, or something is not clear to you, whether it's related to, especially if it's related to your patient, don't just nod and pretend that you understand, because I myself was doing this when I was starting, where I just nod even if it wasn't 100% clear to me what they were trying to say. Do you understand what I'm saying? If you do not ask them to repeat it to you, you just nod, so they will really assume that you understand. Don't think that what you're going to ask will be, stupid questions. There are no such things as a stupid question. All questions are valid and all questions are encouraged. There's no penalty in asking, so that when you're on your own in the unit, you will not have these doubts if what you're doing is right or wrong. The number 4 tip that I will give you guys is to study. You have to do your assignment, guys. Your preceptor can only do so much at the bedside or in the unit when you're at work. So guys, here in most of the hospitals, if you're working in the ICU or in the wards or in ED, most of the shifts are 12 hours. So you would only do like 12-hour shifts in a day, and then 3 shifts in a week. So that's like 3 days in a week and 4 days off. So your preceptors can only do so much in those 3 days in a week, and that's a 6-week program. So in the days that you are not with your preceptor, you have to do your assignment as well. Do the studying or the digging or the researching yourself. Make yourself informed about all the policies, procedures, and guidelines of the unit, all these procedures that they do in the ICU. I printed out all the policies or photocopied it and put it in a folder, and I compiled it. And when I was starting, I tried to read them all so that I am informed myself. They wouldn't ask you these things, they wouldn't really say to you, print it out or photocopy this or photocopy that. You have to initiate it yourself and help yourself out. So guys, if you do all these things that I've already told you, you will be ahead of the game, and there is no way that you're not going to pass or going to succeed unless you don't do the tip number 5. Tip number 5 that I can give you, and it's very simple, and this is the easiest thing that you can do, is to smile and be friendly. Remember guys, these people, your preceptors, your colleagues, have lives outside of work just like us. They can be anxious and they can be having problems at home with their families, or problems with work, with their personal lives, and you cannot know all of these things unless you ask them or unless they tell you. So just be nice and smile to them, ask them how they are, communicate with them. This is a saying that I once read somewhere, that people might not remember your name, but they will always remember how you made them feel. So it applies both to your colleagues or to your preceptor or to your patients as well. It goes both ways. So guys, I'm not saying to be over friendly or to become, to smile all the time like you're in the picture, but I'm just saying, be somebody that yourself want to work with in the unit, and be somebody that you will be inspired to work with when you're on shift. And hopefully guys, you finish your adaptation program in a 6-week period. But even if you don't be disheartened and don't feel discouraged, because they can extend it up to 12 weeks for you to be more comfortable in the unit and with the procedures, and comfortable with yourself as well in the hospital setting here in Ireland. That doesn't mean that you're not qualified enough. It just means that you need a little bit more time and to adjust, and that's okay. Hope you find value in this vlog, guys. That's me sharing what I've learned in the past 5 years of working here and doing the adaptation myself. Last but not the least is I want to congratulate you if you are currently doing your adaptation program. I know you will pass the program with flying colors. Just trust yourself, believe in yourself. That can make a lot of difference. And if you've already passed the program, thank God, you're done. And let me know what's in your mind by commenting down below. And once again, my name is Boyd Ventura, your Filipino nurse in Ireland, and I will see you on the next vlog. Bye. You don't like it? You don't like it? Okay. Let's remove it. Let's remove it. Let's remove it. No, it's fine. Oh, just a sip of coffee. I don't know. I got exhausted with that already.